started using this CCS or critical care suite in early 2020, just before the pandemic hit, and we gained the first-hand experience around where AI can play a role in our practice. To sum up again, like it's an on-device AI alert, which is available on the mobile X-ray system, and it is designed to quickly identify and prioritize critical cases with pneumothorax so that clinicians can respond in timely fashion. So the first case is about the ongoing pandemic. Like there are recent papers that are coming on this topic by like the complication of barotrauma in COVID-19 patients, especially those who are intubated and undergo positive pressure ventilation. And look at this example with extensive pulmonary parenchymal opacities within bilateral lung fields, which are typical for advanced COVID pneumonia, and there's endotracheal tube in place. But there was a surprising finding on this examination, which is a sizable pneumothorax on the right, which was accurately flagged by a critical care suite. And the response to that was we were able to quickly address it and inform the clinical team to place a chest tube, and the chest tube was placed within 15 minutes of the call. Otherwise, you can imagine a routine day where there are more than 150 exams on the work list, and it's kind of takes almost 6 hours to reach any scan which has no flag attached to it. Second example, another COVID patient, this time with a past history of a lung cancer. And this example shows that it's not only the radiologist, but the entire team that is involved in the patient care when you use critical care suite. Like walking along the timeline here, you can see that the chest X-ray was acquired at one point and followed by the critical care suite kicking in and flagging that information. The technologist on the call, that's very interesting. So the technologist on call looked at that alert, and he was new to this technology at that point of time, and he said like, oh, I saw something and this is a trigger and it says pneumothorax found, let me call the resident. So he quickly called the resident and enlightened him, telling him that, oh, there is a critical finding on this COVID patient. Do you want to have a look at it? And the resident just quickly looked at that patient, and the team was informed in timely fashion. So it's kind of the entire team, starting from technologists to the radiology resident to the attending, that are making use of this wonderful technology.